the international webinar, and the topic of webinar is clinical pharmacy. What is the scope of clinical pharmacy? What is clinical pharmacist, and what are the different roles of clinical pharmacist? So, further before further proceeding, I also welcomes to our guest, today's speaker, Dr. Praveen Kumar Ingre sir. Uh, he is with us from Malaysia. So during this COVID-19 pandemic, there is an increasing demand of this clinical pharmacist in European country, and these clinical pharmacists play important role in the healthcare system. They assist, or we can say that they work with the physicians, and they play important role in the community healthcare as well as in the hospital management. So from today's webinar, you will come to know what is the clinical pharmacist, what do clinical pharmacists do, and how do clinical pharmacists care for the patient. Apart from this, you also will get the knowledge about this branch of pharmacy, that is clinical pharmacy, which has very important role in this kind of pandemic situation. And being as a pharmacist, what are the future scope for your career in this branch? So Praveen sir will ignite your minds for this session. During this webinar, he will focus on different aspect of this clinical pharmacy. So this is an just short means a little bit um, uh, short approach towards the focusing this branch and igniting your young minds irrespective of that your career. I would like to thanks to the Praveen sir for being with us. Uh, so for further proceedings, over to Sagar sir.
Thank you, sir, for giving a short brief regarding with the today's our intention to organize this webinar. I request all the participants here as like that of the Zoom application and the GoToMeeting application. There is no such kind of the access binding mode for not presenting any kind of the presentation over here. So I request only our host and guest and the resource person can only going for the presentation. So other peoples are requested to please not to log in with the presentation now. Only our guest and resource person will going to present over here. Now I would like to invite our Assistant Professor Panchade Madam to please give the introduction of our today's resource person.
Yes. Good evening to all. Myself, Professor Ushali Panchale from Dr. Rajendra Gode Institute of Pharmacy, Amravati. I feel very glad and privileged to introduce our today's guest, Dr. Praveen Kumar Ingre sir, who is currently working as a senior lecturer in Department of Pharmacy Practice, School of Pharmacy at International Medical University, Kuala Lumpur, Malaysia. He serves as an editor-in-chief of Journal of Pharmaceutical Research and Clinical Practice, which is published under a well-known publisher, Wolters Kluwer, since 2011. He holds the 14 years of teaching experience and published more than 50 research, review, short papers in national and international journals and guided many undergraduate and postgraduate students. He has served as advisor for the 6th International Postgraduate Conference on Pharmaceutical Sciences 2018 held at International Medical University, Kuala Lumpur, Malaysia. He is actively involved in designing, developing, curricular mapping, and content delivery of a newly launched Master in Pharmacy Practice, which is a postgraduate course with clinical research specialization. and also contributes to other healthcare programs like postgraduate diploma in diabetes management and education. Apart from teaching and administration, he is also involved in developing teaching tools, teaching and coordinating other academic activities like blended learning, case-based learning, problem-based learning, computer-aided learning, objective structural clinical examination, skill development, dispensing practical, professional skill development, pharmaceutical care plans, workshops, and tutorials, e-learning, e-forums, activities, free classes, etc. He has also contributed his service to community, being an international medical university care home leader for one of the handicapped and disabled children community homes. So today, Sir is with us to guide us about clinical pharmacy and pharmaceutical care and future opportunity for clinical pharmacists. So I request our honorable guest to share his explicit knowledge with us and guide us. So over to you, sir.
Thank you, madam. Now I would like to Praveen Kumar Ingre sir to start today's session. Over to you, sir. Yes, sir.
Okay, first of all, thank you, Panchale Madam, for giving my introduction to all audience, and then just now I will start my presentation. So yeah, so good evening, everyone, and hope you all are doing well in this pandemic scenario. And thanks for inviting me as resource person for this today's international webinar. So at the outset, I would like to thanks to all management team members of Dr. Rajendra Gode Institute of Pharmacy and Dr. Rajendra Gode College of Pharmacy, Amravati. I would like to thanks to Dr. R.L. Bakar sir, Professor Savarkar, Professor Ajmire, Professor Ande sir, and Professor Gulane sir for their efforts to organize this today's international webinar. And at last but not least, dear all pharmacy students and those are watching this online webinar. Okay, so regarding coming for this today's topic, that is clinical pharmacy, pharmaceutical care, and opportunities for clinical pharmacists. So regarding this today's topic, I tailored the content to match the need of Indian curriculum, and hopefully it will be beneficial for all the students. So it is not only related with the PharmD students, so it will be also useful those are in pharmacy. So it might be like D Pharm or B Pharm or PharmD or postbaccalaureate student, or those are MPharm in pharmacy practice. So here my focus is particularly about the clinical pharmacy and how is the growth is going in Indian scenario. So in this presentation, I given my own opinions, and also I use some literature, my own experience to learn from it. So in that way, I'm presenting this my today's topic. So I'm presenting this topic only, not only in consideration with the student and faculty, but also keeping being good human being in mind. So whatever, whenever like possible, I try to mention and quote some example with the clinical relevance, so that you can understand this topic very well. And I think, to my opinion, it will be beneficial for you. It will be helpful for you to get better understanding and also the thinking. So this presentation is only for educational purpose and not for commercial use. So with this short things, I will start with the presenting this topic. So whenever you are thinking about the clinical pharmacy, and so it's like one discipline out of pharmacy practice. So pharmacy practice is an umbrella term, and in that a lot of the different disciplines are coming. One of the discipline is clinical pharmacy. And whenever you are thinking about the pharmaceutical care, so pharmaceutical care also involves many components, so that we are going to see now in this today's presentation. And at the last, you are more eager to know about the future role of the clinical pharmacist, because now in India still we are growing in that direction. And so in coming time, I feel that I felt like there will be a good growth for the clinical pharmacy students. So this is just my YouTube video, so you can watch other YouTube video that I delivered in this pandemic time. So in this scenario, in this situation, I delivered some of the topic earlier, relates with the patient safety and also the importance of self-reflection in the development, in your own development. So just you can scan this QR code, and you can later on you can go through these all videos. So to my opinion, it will be helpful for you in some sort. Okay. So yeah, this is the quote that I prepared, and I developed my new skills. So just I'm telling to you, this one I developed in this my 2-3 months of time period. So this quote is regarding live in present, think about future, and learn from reflecting on your experience. So it applies to all. It's not only related with the pharmaceutical education, but it's related to your day-to-day life. So as we are having this pandemic scenario, that's why your college taken an initiative to have the online delivery, and then I am delivering the content online. And this is the opportunity we got because of this situation. So always we are thinking in a positive way and in different perspectives. So that is the thing, how you can move forward. So in this case, you need to nurture your brain. So as a pharmacist, again, you need to be think accordingly, like how you're updating your knowledge regularly, and how you're thinking in a positive way. So just we'll move forward to the content of today's topic. So first of all, I want to just ignite your the critical thinking. I just want to brainstorm you before starting this session. So that's why my presentation, my style of presentation is somewhat different. So I'm not usually taking as usual what we're getting information from the lecturers or something like that. So I believe in simplified teaching, as well as also I believe in the content should be very proper and the student can understand, it's very easily. It's not like difficult task I'm presenting always. So that's why the background is very important, to know the root cause of the problem. And that's why I given here the background, then introduction, then the pharmacy practice, and what are the different disciplines of pharmacy practice. One of them is the clinical pharmacy. So everything we cannot cover from the pharmacy practice, but here we are mainly focusing on the clinical pharmacy. And then pharmaceutical care, what is the research perspective. So earlier I talked with your lecturer, and then I just gather some information, and then I realize, okay, this research perspective also, it's important to all of you if you are thinking about your research in coming time. So that might be, B Farm or M Farm, or any other research. So these are the basic thing you need to keep in your mind while designing your research. That might be also PhD, your thesis. Okay. And then again, the next point is future opportunities for clinical pharmacists. So it's a wide range. You can start thinking from India, and then you can go abroad to have good job. And that is the opportunity we'll discuss today for the clinical pharmacist. And then at the last, what message I want to deliver to all of you. So hope this today's session will enhance your knowledge in some aspect, and you will think about the pharmacy profession in a positive way. So what is the background? So actually, I want to start with the knowledge. So this is a just type of brainstorm to all the students. So everybody just think about how much knowledge you grab from your time duration. So you might be in first year, you might be in your M.Pharm, you might be doing the PhD. So it relevance to all. So I'm not talking about those are in first year. So it's about all. So it's about lecturer also, and it's about me also. It's not like limited to anyone. So knowledge. So actually knowledge you can build up in day-to-day life. So it's not about just you are, reading some books, referring some textbook, referring some references book, and just you're appearing for the exam. So it's not all about that. But knowledge will help you to sustain at any point of time, whenever is a challenging time. So knowledge is the one thing you can survive in all the condition, in any condition. So for that, you need to assess yourself. You need to assess regularly that how I am moving forward in my career or in my particular student life. So you need to assess yourself. Rather, somebody is telling that you are not performing well. So as a student, you need to build up, you need to have a proper knowledge, and later we will discuss how it should be evidence-based as it's coming to the pharmacy student. So once you have the knowledge, ultimately you will get confidence. So ultimately, if you have the confidence, you may have a good communication skill, interpersonal skill. So that will also helpful in your job. As you see, many particularly, the job, they need a basic skill is to have the proper communication skill and interpersonal skill. So rather I can say every job needs that. So you should have the proper communication skill as well as interpersonal skill, so that there should not be anybody to monitor you. So that is meaning of interpersonal. So you need to take your own lead, and you need to proceed in that situation. So that means the interpersonal skill. So here you can see the photo. It's not on about the dispensing the medication. The pharmacist role is beyond that. So if you are thinking about your the conventional time and traditional time, now the role of pharmacist is changed a lot. And also Pharmacy Council of India and other governing bodies, they took an initiative to change it many dimensions. So like in that way, the self-directed learning, so that initiative also they're expecting from all of us. So as the PCI is taking some initiatives, and also at the same time as a student, as a lecturer, as an institute, as a management body, everyone, so they need initiation from our side. And once if it is coming with the student, they should have a self-directed learning. So as why there is a self-directed learning, so the initiation should start from the student. So that is the meaning of self-directed learning. So everything you cannot get in 1 hour lecture, so you need to be study out of the lecture hall, or your practical. So whenever it comes to the practical skill, only the practicals can enhance that. But when it comes with the knowledge, then the self-directed learning, the reading habit, and also reading some the journals articles, or that might be your reference book, that might be your textbook, or maybe the lecture notes that given by your lecturer. So that the self-directed learning, and also out of box you need to think to learn something new. As like many examples of drug like ranitidine and gefloxacin and all other drugs, they got banned from the market, most of the market, pharmaceutical market. So in that scenario you need to be evidence based, so you should know what's going on in the current market and how you can develop your skills. So before that you need to know what particular skills you're lacking, and what particular skills your particular job is in need. So whenever if you're thinking about any job, you need to see what are the skills I need to acquire for doing a better performance in any organization, in any institute. So this self-directed learning is a lifelong process, and also it will help you to enhance your knowledge, and you will be innovative in that case if you're just following the time. So be with time, don't get behind the time, and in that case you will be innovative and you will be different from all other people. So lifelong learning, that is again one of the aspect of self-directed learning. So lifelong learning is also one of the aspect that will help you to build your knowledge and do something else new than what other peoples are doing in a conventional way. So experiential learning, so having experience is not only the thing. So if somebody is doing something to grow, you can take any example in community, you can take any example. So those having more experience, it's not meaning that they knows everything, but the thing is that how they are going to correct the mistake they did in their past life. So that is the experiential learning aspect. So whatever the things you're doing mistakes in your past, you need to learn from that, and then you need to get lesson from it, and after that you can apply, and then you can proceed further in your career. Developing skills, so I'm talking about here the new skills. So whatever the skills are you lacking, so you need to update that. It might be related with the the application. You might be heard about some uh, artificial intelligence. So in that case you need to be very particular about your skills, and then we'll see later on how this AI, that is artificial intelligence, will impact the pharmaceutical market. Again, next to that is a self-reflection. So you need to reflect on yourself to know what are the mistakes you did in your past and how you can improve on that. And by that way, you should be innovative and you should stand, different from all others. So what you are doing, it's not here, but what you are doing is what matters. Again, by having the intervention, so you need to see what are the innovations you are doing, and by that way you can do some intervention, and by doing the intervention you can succeed in that particular program, or might be your career, or might be it applies to all scenario. So intervention is also very important. So in this case, you need a brain exercise. So what do you mean by brain exercise? All of us, we know that we need to go to the gym, and we need to have our physical health. So by doing the physical health, we are having some particular exercise, but this is all about the brain exercise. So you need to learn the new skills, also you need to teach to the others the new skills. So by that way, how you can do it, your brain exercise. So coming for the introduction, so pharmacy practice. So pharmacy practice mainly is a discipline of pharmacy, and also includes mainly three types of pharmacy in it. The first one is a hospital pharmacy, clinical pharmacy, community pharmacy. So this is just a basic thing. I don't want to go in much detail. Just I want to discuss in short, what do you mean by pharmacy practice? So here I given the specific word, and that matters here a lot. Like, the pharmacy practice. Just a minute.
Sir, I think so. There is a slideshow get off. So
Okay, I think I think other people, they have the access. So maybe you do some setting that others cannot interfere in that.
okay, sir. Okay, sir.
Can you please? Yeah.
Yeah.
Otherwise, it will create the problems in, if they're not supporting us, and then it will go wrong.
Yes, sir. You can start now presenting.
So where I stop, I don't know actually where I stop just now, or
Slide, sir. This discussion is going on.
now okay?
Yes, sir. It's completely visible.
Okay, thank you. So we talk about the other, our background, and hope so you know the things like brainstorming for this, topic. So whenever you are coming for this pharmacy practice, so pharmacy practice mainly what we discuss about the three main branches is a hospital, clinical, and community pharmacy. So pharmacy practice mainly is a discipline of pharmacy, and it helps to develop the professional role of a pharmacist. So as we discussed earlier, it's not all about the dispensing of the medication, but in a new era, there are a lot of roles of clinical pharmacist in it. As if you're thinking about the hospital pharmacy, mainly it comes with the procurement, storage, dispensing, and distribution of the medicine. And as clinical pharmacy, it is mainly patient care oriented, and also it includes and optimizing medication therapy, also promotes the health and disease prevention. So clinical pharmacy, you can see the role of clinical pharmacists to optimize the medication therapy. So it should be evidence based, and as it should be outcome based. So it's all about the positive outcome. So in that way, we are making sure that the patient is not getting harm, and at the same time it is considering to be patient safety. So as you know that WHO, they started the campaign last year in 2019, the patient safety. So everyone is they are taking some initiative to have a good patient safety. So it's not all about only the doctors, but everybody needs to be involved, and by that way we can have a better patient safety. So last one is a community pharmacy. So public access to their medicines and advice about their health and disease prevention. So community pharmacy setup, particularly, it's sometimes it's called as retail pharmacy also. So in many countries, the community pharmacy is not only dispensing the medication, but they have their own setup to have the counseling for the patient. And also they're doing some type of basic blood test, like, diabetes patient. So doing the random plasma glucose or doing the fasting plasma glucose. So some of the community pharmacy, the retail pharmacy, they started already this particular initiative. So in India, maybe some of them, the city, they already started with these services in their community pharmacy, but still some they need to start. So self-assessment. So as a pharmacist, so all those are watching, and those are online. So just think about your self-assessment as a pharmacist. What you know about the medicine. So as a pharmacist, we are the medicine expert. As you are studying now, and maybe later time you're going to do your job, maybe in organization, maybe in some industry, maybe you're going to be a lecturer, and maybe in the academics, or maybe you're going for your further research. So in that case, what self-assessment is needed? So in self-assessment as a pharmacist, I just quote here one example. So just think about that. If you have gone through my previous slides, because my presentation is somewhat different, so don't expect answer in this session itself. I will ignite your mind, and then you need to go, and then it's like homework. Okay, and as a pharmacist you need to think about that, and that is the way how we can improve. So everything I won't relieve actually in this intentionally, in this my session. So if you have gone through the earlier slides, you can see the first slide is having these all the tablets and capsules, and some are white, some are very colorful. So my question is here, why the different colors of tablets having the different colors? So that is my question here. So you can just go back and then refer the literature, and then you can enhance your knowledge why there are different colors, why all tablets are not white in color. Okay, so this is just homework for you. So self-assessment, coming for this point, self-assessment as a pharmacist. So do you know about the storage of medicine? So how you're going to store your medicine, how you're guiding to your patient. Say suppose you're a community pharmacy, say suppose you're a student, and maybe some of you may have some patient in your home itself, those having the diabetes, and maybe using the insulin injection, or maybe any other formulation. I will give the example one by one. So in as you know, I'm a diabetic specialist. I'm my most of the research in diabetes area, so I prefer to give the diabetes related the examples. So here just I want to quote one example, like how we are storing our medication in the fridge. So in the door part, or maybe inside the compartment in the fridge. Okay, so you need to think which is the ideal place to store the medication. So obviously door is not the right choice, because a lot of time if we are opening the door, it may fluctuate the temperature of the formulation. So some formulation, if you are looking at, is like example amoxicillin. So amoxicillin will be there in a powder form, and if we are reconstituting it with the saline, and then we are making a solution of it, so we need to use the solution within 7 days of time period, and also we need to store properly that amoxicillin solution, right? So as a pharmacist, your role is very important to educate the patient So that is one of the aspect of self-assessment. So are we doing that as the patients in your home itself? But as a pharmacist, are you giving advice to them? Are you having proper guidance to them? Even though I did some research earlier in my time period in my career, so I just conduct one survey related with the medication disposal. So most of the pharmacists, they are not aware like how we can dispose the medication properly. So that is the case. As a pharmacist, you need to be updated, and then you need to know about medicine. So because this is your profession, and then you need to maintain it. So only the thing like knowledge can improve the things. So coming again to the storage of medicine, if say suppose some patient, diabetic patient, want to travel, so how he can carry that particular insulin with patient? And in case if he is taking some insulin meanwhile the traveling, in case of hypoglycemia, what particular steps he need to do? Say suppose he have the hypoglycemia, so in that case he should have some the sugar product. So might be candy, might be chocolate, so by that way he can maintain his sugar level. So that is how you can overcome on the hypoglycemia. Okay. And these are the the example I want to just ignite, that as a pharmacist you should know there are many lot of components are there, but only I specifically I took here the storage of medicine, and just I want to let you know that how you can start thinking, and as a pharmacist what particular education you need to give to your patient. So it will be relevant to your patient, it will be relevant to your the relatives, or your those are suffering from that particular disease condition. Again, I just quoted here some of the example of drug interaction. So as you may, some of you may aware about the warfarin. So warfarin is the drug having many drug interaction. So if you are going through the literature, over 500 medications they have the interaction with warfarin. So warfarin mainly increase or potentiate the risk of bleeding. So example is aspirin here. So if the patient is taking warfarin along with aspirin, there will be a greater or potentiation of the risk of bleeding. And at the same time, you need to monitor the INR level of the patient in case if there is a bleeding or chances of bleeding. So there are certain parameters you need to monitor if the patient is taking warfarin, having some concomitant medication like aspirin. So some of you might be aware about aspirin, or there are many brands, or the generic also available for the ecosprin or many other generic brands. So in that scenario, the patient might be taking aspirin to prevent the further complications of cardiovascular system. So in that case, as a clinical pharmacist, what is your role? So you need to monitor the patient. So sometimes some drugs are given even though we know the drug interaction is there, but we need to monitor the parameters. So in this case, we need to monitor the parameter like INR level, or also what comorbidity the patient is having, what concomitant the medication the patient is receiving, and accordingly we need to dose adjustment depend on the prothrombin time and also the INR level, that is the international normalized ratio. So INR and prothrombin time is very important parameters to be monitored in those cases that having the warfarin or aspirin or any other drug if they don't have the right choice to use for that particular patient. So what I'm meaning to say here is that you need to improve your clinical skills. So as a student you need to improve your knowledge, you need to improve your clinical skills, and also there are many softwares you can use to check the drug interactions. So many hospitals, they have their own system. They are using Medex or Micromedex or Lexicon. They are having again the some website like Medscape or many drugs.com, so they can check is there any interaction, drug-drug interaction in the prescription. So don't think that pharmacist's role is only to dispense the medication, but it's all about the awareness and also the patient involvement. So you need to communicate to all healthcare professionals accordingly if you are screening the prescription, and then if you observe any error in that. So you might be heard about the medication error. So that is one of the example of screening. So medication error might be, it's a dose related or, the drug related or, like a look-alike effect or sound-alike effect. So there are many reasons about medication error. Coming to the next example is atorvastatin. Why I have quoted this example? You can see a lot of people, those having the hyperlipidemia, the lipid level is increased, the triglyceride level or LDL level, okay? Or those patients, the cardiovascular complications, those have this, atorvastatin is a common and very popular drug all over the world. So in that case, there are drug-drug interaction, there are drug-food interaction also. So in this scenario, we are discussing about drug-drug interaction, but for your knowledge, or you might be know about, atorvastatin is also having the interaction with grapefruit juice. So if somebody is taking the grapefruits, they should not take the atorvastatin. So that, particularly create a problem, create a hurdles while taking atorvastatin and grapefruit juice at the same time. So here atorvastatin and cyclosporine. So mainly atorvastatin, this having the problem due to this CYP3A4, that is a cytochrome P450, right, enzyme that mainly occurs in intestine and also the liver, right? So some drugs are inhibitors, some drugs are inducer. So if there is a inhibitors are there, then there will be a potential risk of myopathy. So already the myopathy and rhabdomyolysis. So it's a potential risk if we are using atorvastatin and cyclosporine all together. So it's better to avoid this combination that may cause liver damage, that may have the rhabdomyolysis risk, and also may lead to the kidney damage, and in some severe cases may even death. So as the patient is receiving this combination, getting some, ultimately the death he won't, or the patient won't get in 1 day time period. So ultimately it's a cycle, it takes time. So before that, there are certain signs and symptoms like nausea, vomiting and fever, and so this type of symptom and muscle weakness, the tiredness, fatigue. So all these problems you need to monitor whether if the patient is taking this combination and having the problems. So in that case, you need to report it, you need to monitor it, and by that way we can have a better patient safety. So it's evidence-based medicine. So what is the evidence-based? So rather giving the atorvastatin or cyclosporine to the patient, you can have the better alternative. So suggest a better alternative to the physician, and by that way how you can improve as a clinical pharmacist. So obviously the basic thing is to screen the prescription, to have the proper knowledge, to to detect the drug interaction, adverse drug reaction in the prescription, and by that way you can have the proper communication with the doctor, and that gives you the confidence to talk with doctor or physician. Again, another example is metformin and iodinated contrast. So what is the iodinated contrast agent? So mainly it is used as a radiographic dye. So as we are doing some brain scanning, okay, so brain scanning will be the all the brain structure, the vasculature will be more visible if we are using this iodinated contrast agent. So metformin, I have given here the example of metformin. Metformin is also a gold standard in diabetes patient and also used by many diabetic patients. So in that case, if they have some brain related problems, or then in that case, if they're having the metformin and using the iodinated contrast agent at the same time, so that may induce nephropathy and also the risk of getting lactic acidosis. So this is the way how you can check all the patient past medical history as well as past medication history, so that you know better which particular treatment regimen is required for that particular patient, right? So other drug interactions may have, like the risk of hypoglycemia, like the insulin or sulfonylureas like glimepiride, glyburide. So if you're taking along with metformin, so it's not a severe type of the reactions may occur, the adverse effect may occur sometime, it is light. But if it is severe, then ultimately you need to reduce or adjust the dose of metformin or insulin. So metformin may have the interaction with the insulin or other insulin secretagogue molecules, like the secondary one like sulfonylureas, the glimepiride and glyburide. So in that case, you need to monitor the patient for the hypoglycemia risk. Again, like carbonic anhydrase inhibitor, like example I remember is acetozolamide, right? So it may increases the risk of lactic acidosis. So you need to be very careful while using this acetazolamide and also the metformin together. So in that way, how you can have a better patient safety. So these are potentially fatal. The first one, the iodinated contrast agent. So this is potentially fatal, and you need to be very careful while using this type of drugs. This is the last example I want to quote here is a paracetamol. So paracetamol, as you know, that is having a broad therapeutic index. So you might be heard about the narrow therapeutic index, and having the drugs with the margin of safety is large. So what is the meaning of that? So actually the digitalis is a narrow therapeutic index. So if you are increasing little bit dose also, it may lead to the toxic aspect, right? So it may lead to the toxic aspect of that drug. So you need to be very careful in that particular aspect of using the narrow therapeutic index. Here, this paracetamol, even though it's the margin of safety is bigger, but still this paracetamol sometime it's a rare condition, but still sometime in some patient, those are using warfarin plus paracetamol, the anticoagulant effect may enhance by using the paracetamol and warfarin at the same time. Also, you may know about other coumarins. So coumarins is an anticoagulant class that also may have the prolonged effect due to the paracetamol on using the coumarin at the one point of time. So obviously the patient may have the risk of getting bleeding in that case. So some example, the other drugs like metoclopramide and domperidone, it's a very common drug we are using for the nausea, vomiting sometime. So increase absorption with the metoclopramide and the domperidone. So sometimes the paracetamol may increase the risk. So I think again my presentation slides is getting problem here. So let me try. Okay, just let me try now. Okay, so as I given the example here, the last example is paracetamol, and you can see here the World Patient Safety Day, right? So as I mentioned earlier, the World Patient Safety Day is, the WHO, they took the initiative and they started in last year. So it's almost like it's going to be 1 year now. Because they started in 17 September 2019, and then they marketed in such a way that the every healthcare professionals, they can participate in patient safety aspect. Just going to the next slide. So these are the resource material, right? So these are the resource material you can use for the updating your knowledge. So once you are considering with the Indian perspective is that ICMR. So most of us, we are following the ICMR. If you are considering with the recent pandemic, the coronavirus, COVID-19, right? So ICMR, they came up with the different combination of the antivirals and what are those antiviral we can use in those conditions, particularly in the coronavirus pandemic. So everyone is using different types of resource material to enhance their knowledge and then be up to date with the today's time. So there are many others like WHO, World Health Organization. They are having a lot of information regarding the many disease condition. You even know the statistics of the disease condition in the many countries. Again, there is a Center for Disease Control and Prevention. Okay, so here also you can get a lot of guidelines, a lot of rationale of using the medication, and again, US FDA, the Food Drug Administration, and also the clinical practice guidelines. Some country like Malaysia, we are using here the clinical practice guidelines with some of the disease condition, like for diabetes here in the Ministry of Health, they have their own clinical practice guidelines, and they're following what particular the medication should use by the patient, or how there should be a rationale to prescribe the medication. Okay, so coming to the pharmaceutical care, so this all about what we discuss is background and introduction and what particular knowledge the clinical pharmacist should have. This is very important, whatever we discuss up to this point. So now coming to this pharmaceutical care. Pharmaceutical care, as I told you earlier, it's a broad aspect, and that includes many things like outcome oriented pharmacy practice. It is patient oriented, so we need to think a lot of things about the patient centered, even though it's like giving some psychological support to the patient and also to the family members. So it's not all about only for the patient, but also it is related with the family members. So how it goes. So example is palliative care. So palliative care, again, it is coming under the pharmaceutical care. Palliative care mainly in the chronic conditions, like those having the cancer, and also some pancreatic cancer, or any other different types of chronic illness. So in that case, the psychological help and the support is very important to the patient as well as to the family members. So pharmaceutical care, it's outcome oriented pharmacy practice, it's patient centered, and pharmacists need to work with all other healthcare providers along with the patient, sometime along with the family members, and by that way they can promote the health and prevent the disease condition. And at the same time, they need to assess, monitor, initiate, and modify the medication use. As we discussed earlier, the example of warfarin as well as the other drugs, those are having the interaction like aspirin. So in that case, you need to monitor of what? You need to monitor the INR level of the patient. Otherwise, the patient may have the bleeding, the more bleeding, and patient sometimes die, So even though you don't know the drug interaction and patient is dying accordingly. So there are many reported cases. Those are having the patient harm, and even though the patient and those relative doesn't know why the patient died. So this is the need of time, and you need to be aware as a pharmacist. You need to be more aware that what type of care we are giving to the patient. So at the last is drug therapy regimen safe and effective. So that's why it should be safe, it should be effective, and ultimately it should be having a less cost to the patient. So nowadays you can see many generic medicines are also available. So even though some doctors they are giving the branded medicine, but still the government also initiated the the initiation, and they are telling us to use the generic medicine in some of the aspect because of the cost effectiveness. So what are those elements of pharmaceutical care? So pharmaceutical care mainly involves the professionalism from the pharmacist. So it might be the hospital community or clinical pharmacist. So you should be, you know, well professional with your profession as well as the patient care. So you need to be more involved in the patient care. You see now in the pandemic situation, everybody is talking about the nurse and then the doctors and all other healthcare professionals. But even though the pharmacist role is not reflecting here. So why this is so? So we need to be more proactive in those scenario, and also we need to be involved in more patient care. So as I given a lot of example earlier, we need to educate the patient, our patient accordingly, and we need to have the self initiation. Also our efforts need to be more about patient safety. So obviously, to achieve all these things, you need to have the more moral ethics in your profession, as well as you need to know what is wrong, what is right. As like the basis of pharmacotherapy is risk to benefit ratio. So we are selecting the medication depend on risk to benefit ratio. So there are many risks to the patient if we are initiating some medication. So at the same time, we need to know what are the benefits the patient is getting. So if the benefits are less and risk is more, obviously we are not going to start that particular medication therapy to the patient. So you need to be moral, how moral and ethics about your profession. Clinical decision making. So sometimes you need to make a decision. So clinical decision making involves a lot of things like all healthcare professional, as I told you earlier, it's not only related to the patient, but sometimes you need to involve the family members to take some clinical decision. It's all about the surgery or any other, the major operation or any other relevant things. So in that case, clinical decision making is one of the important elements of the pharmaceutical care. Equity in healthcare. So everyone should go and get the equal treatment. It's not all about the rich person or the poor person. So everyone should get the equal treatment in the healthcare setup. Okay. So coming to the next point is a patient data collection. So what actually needs to be done in regards with the patient data collection. So as you may doing your research, or you're having your clinical placement, or you're having your clinical attachment in the hospital. So it's not all about, I'm talking about the family student, but also the other B Farm student, and also those are relevant to this. Okay, so patient data collection. So why you need age, why you need to have the age of the patient, sex of the patient, occupation, and all other parameters. So there is a reason for all these parameters. So whenever you're taking the info from the case report form, you need to collect all the information. I will give some example here. The allergy status. Say suppose somebody is having allergy to the sulfamethoxazole or sulfa drug. So you need to know that, like, this patient is having the sulfa drug allergy. Again, the family history. In case of diabetes, you should know that, okay, father or his mother is suffering from the the diabetes. Social history. Sometime, some drugs may have the acceleration of their metabolism if the patient is smoker. So that comes in social history, right? Some patients are drinking alcohol. So you need to know the social history of the patient in that regards particularly. So say suppose patient is having asthma. So theophylline is a drug. If the theophylline you are prescribing to the the patient those having the smoking habit, so ultimately the theophylline won't give you the therapeutic effect. as the smoker having, the metabolism of theophylline is more accelerated compared to the all other patient, those are non-smoker. So you need to update your knowledge accordingly, and you need to know why we are taking all these parameters into account and why we are, proceeding in that way. Medical and medication history, as we know that medical history is also important. Like, you should know as a pharmacist what particular operations or surgery done in the past time. Also, what are the medication the person is taking from a longer duration. So say suppose, as I given the example, aspirin and warfarin. So sometimes the patient might be taking aspirin from a longer time due to the prevention of the cardiac complication, and then suppose today the doctor wants to start with the warfarin. So in that case, you should know that, okay, this patient is having, warfarin earlier, already the patient is using the warfarin. So in that case, you need to be more cautious to monitor INR level, and that patient should not have the bleeding. So that's why these all elements of pharmaceutical care are important. Medication adherence. So like, the many patient, you can see they are not adherence to the medication due to various reasons. One of the reason is cost. Some they don't want to, invest, or they don't have the money to invest on taking their medication, and filling their prescription every month. So there are a lot of reasons in the all other different, setup. So medication adherence affect accordingly because of lot of reasons. And what is the ideal way then? Generic medicine. So that is the ideal way of using the generic medicine to lower the cost if they are using earlier the branded medicine. Medication compliance. So what is the medication compliance? So how the medication adherence and medication compliance is differing from each other. So medication compliance is like, sometimes the patient is having the fear of side effect. I want to quote here the one example, like, those are having the tuberculosis and taking, rifampicin. So rifampicin may cause sometime, the coloration will be pink and, red in few patient. I think like some patient, they have this, pink coloration or red coloration for their urine or feces even, or sweat or saliva or tears. So this particular drug having the, the metabolites are red in color. So actually this drug will appear in their tears, saliva or sweat, and sometimes the patient will get fear because of this side effect. And as a pharmacist, if you're telling them, if you're getting this type of symptoms, don't have the fear, because these symptoms are harmless, so it won't create harm in many patients. So sometime it might be very rare, it's a very rare, it leads to complication. So due to having red coloration or the pink coloration to the patient urine, so sometimes they are getting fear and they are not compliance with the medication. So ultimately what will happen? So in that tuberculosis patient, the patient will have the multi-drug resistance tuberculosis. So obviously the patient will get the resistance to the all other anti-tubercular drugs, and by that way the patient sometime may die because of developing a resistance. So that is the case, how we can educate the patient. So these are the risk factor. We need to tell the patient accordingly that, okay, if you are not taking this medication, what is going to be happen? So in tuberculosis, the patient may have multi-drug resistance tuberculosis, and that may lead to the death sometime even. So next point is development of drug therapy plan. So accordingly, you need to think all the factors, and also according to the the patient need, you need to develop a plan. So that is the role of clinical pharmacist. So are we doing that in our Indian setup? So that is a big question again. Okay, so this is the the future need, and we need to proceed in that way. If we are not proceeding in that way, we are not moving forward, again it will be trouble for all of us, and then it will be, we are restricting the growth of the clinical pharmacist in that aspect. So as a pharmacist, you need to give the information to the patient about their medicine. Why the medicine? Why they are taking this type of medicines? What are the importance of that medicine, and what are the risk factors? So if there is any risk to that patient, they need to contact to the physician in what case particularly, right? So you need to give that particular knowledge to the patient, and in that way the patient involvement is also very helpful and useful if they knows their medication properly, and if they are getting some adverse effect, they can monitor and they can report to the physician or the pharmacist. So for this all, we need to have the intervention, and then we need to modify the therapeutic plan accordingly while thinking about all the parameters. You might be heard about the new concept is coming now. Not it's not a new, but it's there for quite some time ago now. It's a personalized medication. So now the many pharma industry company, they are working on the personalized medication. So in that way you need to be very updated, like what's going on in the market, and then you should know the things, right, regarding the personalized medication. So these are the other elements of pharmaceutical care, like patient safety. So no harm to the patient, and the harm might be lead because of the many medication error. Sometimes the dose written by the physician is wrong, or sometimes the dispensing medication to the wrong patient, okay, and also sometimes the dispensing wrong medication to the same patient, whatever the patient, right? So in that case you need to be more safer in a patient safety. Evidence-based medicine, as we discussed earlier, evidence-based medicine. So you need to refer the literature, the current literature, the recent literature, and by that way you can select appropriate drug regimen for the patient. And by that way, how we can improve the quality of life of the patient by having the proper pharmaceutical care plan, and also achieving a positive outcome-based treatment approach. So these are all the elements of pharmaceutical care. Coming to the research perspective, so those are doing research in the B Farm, or the other programs like M Farm, or the other like PhD also, even you can think about. So basics of clinical study. So if you want to do any clinical study, and if you are planning to have any research study, what you need to think about whenever you are planning for the clinical study particularly. So you need to have the ethical committee, right? So ethics committee, the institutional review board, or we can say the institutional ethics committee. So whenever it comes to the academics, institutional ethics committee will approve the all proposals that is submitted by the student, research student. So in that case the process will start accordingly, and then you need to frame your research question accordingly. You need to have the proper objective for your clinical study, and it's not like whatever the research done earlier you're repeating the same, but something it should be innovative in that way. So assessing obvious things is not the proper way. So where does research start? You can see while reading a lot of articles, the question mark will be there, or the word will be there, unknown. So what is unknown? So say suppose in some research, these are the things are not revealed yet, or it's unknown. So from there, our research start. So find out the research question first to do your research. That might be for your UG level, or that might be for your PG level, or might be for the PhD. So do your research accordingly, things accordingly, and then you can start with your project. So doing pilot study is very important, like you're doing your warm-up while doing the exercise. So warm up for your research study. So whenever you're planning for your research study, do the pilot study first, and after that you can go for the main study. So that will give you some sort of idea, like what are the things we can improve, and how our research will be innovative compared to all other research done in an earlier time. So sometimes experimental studies and versus observational study. So it's depend on your research question and research objective, what you're going to assess, what you are going to have the answer for the research question. So in that way, you need to design your study by the experimental or the observational way. Another thing is like systematic reviews. So there are many systematic review, even though the students are doing the for PhD, there are systematic reviews. So actually the research question should be frame in that way, so that you will get some evidence about your research question. So that is very important whenever you are doing with your systematic reviews. And it includes many things like pharmacoeconomics, pharmacoepidemiology, evidence-based medicine, or drug utilization evaluation, drug utilization review, and so many, the meta-analysis and cohort study, and lot of things are there actually. Coming to the very important aspect is artificial intelligence or the machine learning. Some of you might be know this terminology, artificial intelligence. Nowadays you can see many pharma companies, they are working on the artificial intelligence. So this is the computer science. So this is mainly about generating the code that the computer knows the coding, right? So it's all about your adaptability, and also how you're improving your new skills in your profession, in your pharmacy profession. So you need to give command accordingly to the computer. It's a basically, it's what I can explain here is a type of tool, so it's a type of tool. You can have a major database in one system, and by that way you just give the command and get the result from the system. For example, I will just quote here one example is like, you want to have the data of the diabetes patient, the cancer patient, how many worldwide they affected due to this type of cancer. So this is a system, you will just give the command and get appropriate answer. So it's a big pool of data, and whatever the question you have, you will get the answer of that, and from that you can learn what is the need of current time, because there are many rare disease condition, even though till date we don't have the medicine for it. So that is the importance of artificial intelligence, that whatever the question you have in your mind, you will get answer for it. Social media based research. Nowadays you can see how the research is proceeding while using the WhatsApp also. While using WhatsApp, many researcher, they did research, and just you can Google it, you can just have a keywords, and you can see how they are monitoring the patient with the WhatsApp group, or with the other social media, and how they are improving their research, and how they are monitoring the patient accordingly. Patient outcome based research. So again, all other factors, these are related with the outcome based research. So it should be positive patient outcome based research. So if you're thinking about all the parameters, obviously you will get the positive outcome, and that will lead to the patient outcome based research, and by that way we have the better patient safety. So now I know that most of you are mainly waiting for these opportunities. You can see passion led us here. So as you are in pharmacy profession, so some of you might be having as an option as a pharmacy, you came accordingly, you took admission accordingly, but some may have as a passion, they are doing the pharmacy profession. So passion that led you here, and then in future you have the lot of opportunities for a clinical pharmacist. Even though I told you earlier, B Pharm also, they can have their growth in this aspect if they have the proper skills. It's not all about the PharmD student. So the basic need here is a communication skill, as well as your knowledge, and also how you are getting update in current situation, in current time. Okay, you can see here the right hand side, aim higher, fly higher. So always if you aim high, always you can fly higher. And if you have the limitation for your dreams, obviously your your growth will be limited in that context. So whatever you're thinking, what is my meaning here is, whatever you're thinking, it will happen in your life. So don't restrict your dreams, see the calculative risk, and then you can think about your career. So at the same time, you need to think all other factors and just made it possible. Okay, so the first of all, whenever you are going for your any interview, so what is the first criteria? What is the first thing you need to do? You should have the proper skills, otherwise you don't crack your you're not able to crack your interview. So obviously you should have the confidence, you should have the proper communication skill, and also you need to be a good learner. If you are going for 5 interview and you are getting fail in that 5 interview, again you learn from it, whatever the mistake you did, and then you can improve. So that's how 6th job you will get. So sometime you need to think in that direction also, otherwise you will be demotivated, and you will take time to improve on that particularly. So basic thing, you need to have your knowledge, the lifelong learning habit, and the experiential learning habit and self-reflection habit, so that you can learn from your mistakes. And after that, if you have all these parameters, obviously you're going to crack your job interview, and ultimately you will get your job in near future. So think positive and be positive. So going for the job perspective, the first thing came in my mind is an entrepreneur. Might be you need to think accordingly. So plan your own. Might be your community pharmacy, might be your retail pharmacy, or your wholesale pharmacy, or maybe you're going to have one organization and just give job to all. So that is the broad way how I can think. That is the entrepreneur skill. Okay, so those are listening, they can also think about that. So entrepreneur, don't limit your dreams. Okay, so be an entrepreneur and give job to others, rather just searching the job for oneself. So if you're thinking about the job, there are many opportunity, like I will highlight here the things like coming from government sector. So government sector, a lot of people have the job opportunity in the hospital, community, clinical pharmacy. So what you need to do, you can see the UPSC, the Union Public Service Commission, or the PSC, the state level, the commission. So those website you can visit, you can log in there, you can have your password and log in, so that you will get all the updates from them, UPSC site or PSC site. So in that way you can develop your career in the UPSC and PSC, and you will get the current job opportunity for the particular that sector. Coming to the next point is the Pharmacy Council of India. So Pharmacy Council of India also have the opportunity for the pharmacist. Okay, so they are also recruiting some pharmacists for some of the job, job in the PCI office, and also their relevant, the co-organizations. CDSCO, Central Drug Standard Control Organization. So Central Drug Standard Control Organization is a Delhi based, and they are monitoring the adverse drug reaction. All the reports will go to the CDSCO. Okay, so again, the next opportunity will be in the government sector, like Sports Authority of India, or Ayush Department of Ministry, and by that way you can get a lot of JRF and SRF in that way. And there are many, I just given some, like Sports Authority of India and the Ayush, but there are actually many government organization you can get job. Just you need to put the right keywords in the Google or any other search engine, so that you can get the relevant the job opportunities in the sector. Indian Railways, even though you can see the Indian Railways have the pharmacist post in it, National Rural Health Mission, even bank, State Bank of India, you can see, you can Google it, healthcare expert. So as a healthcare expert, you will get also opportunity in the bank sector. So they need advice from the expert, like a pharmacist, like so some aspect you might not aware about, but you need to just think accordingly, you need to search accordingly. Everything is there on your fingertip, but you just need to search it, think it accordingly. So you can see the government sector, a lot of opportunities are there. Only I given some few. Even though you have some airport pharmacy nowadays, the airport pharmacy is also there. You can work as a pharmacist in airport pharmacy. There are many, the community pharmacy chain, retail chain is available in the India. We will see that in the next slide. So as a hospital pharmacy, you will get job in multi-specialty hospital. As a community pharmacy, you may have the hospital or the retail pharmacy or the wholesale pharmacy job. Retail pharma companies, they also have the many chain of the pharmacy, like in India, like more than 20 now they have their own retail pharmacy chain of the companies, and you can work in that as a community pharmacy, or you can have your own with the having MOU with them, having the memorandum of understanding with them. At the same time, you can have the airport pharmacy. Indian Railways have the opportunity to be a community pharmacist. Online pharmacy with the consultation. So now you can see the pharmacy practice regulation that given by the Pharmacy Council of India. So they had some change in the regulation. So consultation, as the pharmacist, you can also have the consultation and you can charge for it. So as I told you earlier, some of the country, they already started with their counseling unit and they're counseling the patient accordingly and they are getting benefit of it. So that is our main objective, to give the benefit to the patient in a correct way, so that the medication adherence and compliance will be better for the patient. So online pharmacy, this is again new aspect. So one can think about the online pharmacy also, or you can work as an online pharmacy. So here you need to develop your skill accordingly, and then you can start with your online pharmacy, or you can work for those are doing in that sector. Coming to the pharma sector or the industry or the company perspective, the clinical research organization. So you can see a lot of opportunities are there as a CRA, clinical research associate, coordinator, clinical research coordinator. So you may become a team leader afterward that. So like, you can start your career as a clinical research associate. Don't expect, the high salary at the first your appointment itself, but don't compromise even. I can tell that one also. Okay. So don't compromise and don't also think in the bigger way. So you need to, you need to balance that. So you can start with your the assistant level, like clinical research associate or coordinator level, and then you can think about the team leader and expert associate or manager. Even though you can grow up to director or president, it's depend how you progress in your career. So there are many opportunity in the clinical data management, medical coding. Medical coding is also one of the growing component now, the growing, the discipline now in the clinical research organization. So clinical data management is the managing all the data. So whatever the data you're collecting now, as in your student time, in your placement or in your attachment, so that will be helpful to have this clinical data management process. Medical writing. Medical writing is also a good profession. For that, you should have the proper skills of writing. So build up your skill accordingly. Try to present something to the conference or online, or do it accordingly, so that the medical writing position, you can think about that. So for medical writing, you need to develop your skill accordingly. And for the medical writing, always you need to think in writing something. So that might be your self-reflection writing, or mainly related with the medicine. So what is the changes going on, the evidence-based changes, and accordingly you need to think to have the proper growth in this particular sector. So if you are really interested for the medical writing, you need to think about all the skills you need to develop. So that might be the medical writing or might be the medical coding. So coding is, the name itself indicate that it's, you're giving the coding to all the procedures, and then the all the surgery, or that might be the any procedure in the medical setup. So it's all about giving the coding and also closely working with the physician. Okay, so that all includes here in the medical coding. Here the another area where you can get the opportunity is the regulatory affairs. So regulatory affairs is there in the CRO as well as in the pharma company, in the pharma sector. So regulatory affairs also you can think about, and then for this you need to have some proper skills like knowing the guidelines, the ICH-GCP guidelines whenever it comes to the clinical research area, and also the schedule Y. So might be you heard about these all things in your curriculum, but maybe you need to go further beyond that and develop your skills accordingly. Pharmacovigilance, the monitoring of ADR. So it might be at the hospital setup, or might be at the company setup or organization setup. So you may become a clinical research associate first in this pharmacovigilance, and then you can grow further after that. PKPD study, the pharmacokinetic and pharmacodynamic studies. Even though you can think about going in this area also, if you are really interested in the pharmacokinetic and pharmacodynamic studies. Artificial intelligence, as I told you earlier, artificial intelligence and machine learning. So this sector is growing now in the preclinical as well as in clinical research. So artificial intelligence is a computer-based program, and then you just need to give the different the command, and by that way you will get all the information, relevant information, whatever the information you want from the system. So product manager and market research is closely related with each other. The product manager is the manager who doing the research in the product marketing, particularly how we can sell the product, how we can give the competition with the other product. Those are competitor in the market. So basically you need to do some market research. So it start from your skills accordingly. So say suppose for example, I want to give here example is like some bottle having the label. So label is also matters. Sometimes the patient while taking that particular medicine is not feeling well because of that the appearance of the bottle or the color of the label. So you need to think accordingly. So that is the responsibility of the product manager and the market research. Okay, so again I think the PPT is not visible. Just I will do the setting once again. So I think now you're able to see my screen, right? So just a minute, I will just yeah. So these are the opportunities we discussed already, the product manager and market research, right? So coming to the next, the opportunity is academic, right? So academic and research institute. So in academic and research institute also, you can have your, the future. So how you can have your future in the academics, like you can opt for your higher studies, or you can become a lecturer, and then in that way how you can deliver, how you can grow in that aspect. So just I will try to share my screen once again. Let us see how it goes. Okay, so now I tried once again. Okay, in academic and research institutes. So as I told you earlier before, like you can have the JRF on SRF, and then you can go for your higher studies, and maybe you can become a lecturer first, and then you can grow accordingly in your academic career. So in academic career also you can think about the integrative and collaborative research. Okay, so it's not about the pharmacy, but also you can collaborate with the medical staff, or any other healthcare professionals, so that you will get a good result of your research. So that is the way how you can think about. So jobs in abroad. So what particular jobs those are waiting for you in abroad? So in pharma industry, including CROs, what we discussed earlier is like we have a lot of opportunities in abroad also, but also you need to think about what are their requirement, what particular skills you need to adopt, and also you need to think about what are their regulations. So say suppose you want to be a hospital or community pharmacy, so it's not an easy task to do that, because you need to go for certain basic test. Say suppose you are thinking about the USA. So in USA you need to do some test first. So like American board, they have their the website, and the requirement is mentioned there. So you need to fulfill that requirement, you need to appear for their exam, and after that you can get a job opportunity in the other countries. So some countries like Canada, they are also offering the permanent residence, so there are many opportunities, but only the thing is that you need to have the proper communication skills, like the TOEFL exam. It's mainly checking your communication skill. And also there is another exam is GRE, right? So GRE is particularly the mandatory in case of your going for your higher studies. Okay, so you need to be prepared in that way. Okay, and also in abroad you will get academic job also, even so don't restrict yourself in Indian scenario, but you can think about, and then you can move forward to the next level. So the basic thing is you need to be more aware about the things that going on worldwide, and you need to be more updated. So in that way you will get a good opportunity in the abroad also. Okay, so many people were thinking like the consultancy will help or not. So sometimes consultancy, the some consultant are good, but don't rely 100% on them. Okay, so if you don't know the process exactly, so my opinion is like don't believe everyone accordingly. So sometimes there might be many many things are going on, and already about that, right? So think accordingly, and then you can apply for the jobs in abroad. So these are the references I use for my presentation today. Okay, so what is the last message I want to give you here is that let's contribute to the pharmacy education and research by enhancing the quality education. So with this presentation, I will make a stop. Okay, and then I will just stop sharing my content, so that the Sagar sir, you can continue with your session. Yeah.
Yes, very thankful to you, sir. You have given a very good knowledge regarding with the job opportunities, clinical pharmacy oriented jobs. Right now, we are going to take a one question answer session. So
Yeah.
I request Assistant Professor, Assistant Professor Chaitanya Ulane sir, to please take the questions from the audience, the participants, regarding with the today's session and convey it to Dr. Praveen Kumar English, sir. Over to you, Chaitanya Gullane, sir.
Thank you, sir.
Yeah, thank you.
Yeah.
Thank you, English, sir, for this wonderful session.
Thank
It
you.
was very informative regarding the future opportunities for our upcoming budding pharmacists. Now, it is the time for question answer session. So those having the queries and doubts can put their queries in the chat box so that we can convey it to the honorable sir. Or you can interact with the sir by making your audio on. But firstly, you have to put your query in the chat box. So one question is from Mahesh Gaikwad. Am I audible to you, Mahesh? Okay. So
Yes, sir. Chaitanya, sir, convey that question to the sir. Sir will answer that question.
okay. So the question from Mahesh was, for the clinical research associate, what should be the minimum eligibility or need some other courses? Up to you,
Okay,
sir.
yeah. Okay, that's a good question. Actually, I forgot to mention that in the slides because there are many trouble in between. So I just forgot to mention that thing in my presentation. Okay, so as a CRA, the basic requirement for some of the CRO is only the B Farm, But at the same time, as I told you earlier, there should be a proper communication skill. Can you please mute the mic for all the participants because there is echo so that can you please mute on the mic first?
Okay, sir.
Gullane, sir, can you please unmute your...
Because otherwise it's not my voice is not audible to all of you.
Yeah. Yes, sir, it's clear now.
Yeah. So that is actually good question. CRA, like the many CROs, they have the only basic criteria is a B Farm. If you have the proper skills, you have the proper communication, and then accordingly you need to do some the other courses also. There are many courses available online. You can see those courses related with the clinical research. Okay, so there are many postgraduate diploma or the professional diploma courses are available in the but you need to think about which course is having the more impact, the good impact. So accordingly you choose that particular course that will enhance your knowledge, and then accordingly you can take that certification, and obviously that will be helpful to enhance your knowledge and in getting the good opportunity in the clinical research organization. So some CRO, they will take you as a CRA, the clinical research associate or coordinator. If you have the relevant knowledge of hospital setup or having a good communication skill, or you are very updated. So basically you need to crack your interview whenever they are asking the questions to you. Understand? I think it's hopefully you can understand the things. Okay, any other question?
Sir, another question from Prajakta Kulkarni is there. So she is asking for the entrance exams for getting the government job actually. After
Okay.
the
Yeah. Continue. Please tell me.
yes, after the B Farm, she was asking regarding the entrance exam for the government job.
Okay, after B Farm, the government job. That's why in my presentation I told you need to log into UPSC website, and whenever it comes to the Maharashtra, it's MPSC, Maharashtra State Public Commission exam. So there you can see a lot of opportunity once they posted in their website, or once if you have the login also, login details and all of the things. So you will get the notification of the job opportunities. Accordingly, you can prepare for your entrance test. For entrance test, basically there are MCQs. So it's not like, our conventional exam, writing the essay and something like that. Some particular entrance exam, they are having MCQ. So MCQ, they will test your knowledge, so some particular exam, they have the general knowledge also. Some exam, they have the application based knowledge. So say suppose we discuss about a lot of drug interaction on all other clinical relevant things, right? So you need to be updated in that way, and having that all the knowledge, sure you will crack the exam, so that might be the exam, or the interview. So you need to prepare accordingly, and then you need to log in their particular respective website. You can see the newspaper for the details. Say suppose I give the example of CDSCO, Central Drug Standard Control Organization. They are mainly dealing with the adverse drug reaction reporting. So those are interested in pharmacovigilance. So just they can go for that. So I'm not talking about only for the PharmD student. So B.Pharm student also have the many opportunities. Once you know the your target, your goal, so you to just try to achieve that. So that is my opinion on it. Okay.
Okay. Thank you, sir, for making the concept very clear. Now, another question is from Sumit Rautrao, and he's asking regarding your opinion about the careers in patient counseling or regarding the patient counseling.
Yeah, that's a very good question. And maybe after some time we may see the growth in patient counseling. Even you can see the metropolitan city, they started in India itself, I'm talking about, they started their own patient counseling unit. And if I told you earlier, like for the pharmacy practice regulation made by Pharmacy Council of India, they mentioned that for whatever the consultancy you have, the consultation with the patient, you can charge for it, right? So having your own community pharmacy and building your own patient counseling unit there. So basically you need to have passion about that, right? So if you have the passion, ultimately you can achieve it, and that is a good concept, rather I can say. And we can see the growth in that way, patient counseling. So you can counsel the patient in many aspects, like simply for example coronavirus. So we have the hand hygiene, right? So even though some patient, they doesn't know the importance of hand hygiene, the personal hygiene, and even though the social distancing, so in that way patient counseling will be helpful for those particular patient. Now you can see there are many diabetic patient. So diabetic patient, ultimately they are not more aware about the risk of hypoglycemia. Sometime they don't know how to store the medication. So if they started taking the insulin, how to preserve it? If they started, if they have the extra container of insulin, how to store it? Where to keep in the refrigerator? Even you can see most of the patient, they doesn't know actually how to use the the eye drop also. The eye drop, where to have the drop of that eye drop in the eyesight. So that is very minute things, but many people doesn't know it. The patient I'm talking about, right? So it's all about how you're educating the people, and what is the rationale behind that, and how you're improving that patient education. So patient counseling is very much important in that aspect, to educate the people and to educate them to have the proper patient safety. Okay. Yeah.
Okay, sir. One more question from Vedika Sarobe. So, what are the exams after B Pharmacy for the getting the job in abroad? Yes, you already explained regarding the GRE and TOEFL, but
Yeah.
should be little more informative from you.
Yeah, so you can think about GRE, TOEFL, NAPLEX is there. So again, if you're thinking about some country like USA, like United States of America, so you can see their pharmacy board, the website, I think naabp.net. So you can get all the relevant information there. And again, with that, you need to appear for the pharmacy equivalent, the exam. So whatever the basic requirement you have in India, sometimes it is not applicable to all other country. So it may vary from country to country. So it's depend where you are trying for your job, right? So if you are trying in US, so just prepare accordingly. Just go through their pharmacy website, the pharmacy board website, and then you can prepare. You can see the checklist, what you need to do, what particular test you need to the appear. So some country they have the requirement like TOEFL, right? So TOEFL is like English proficiency, how you are speaking in English. So that basic test is assessing your the way of communication you communicate. There are certain the scenarios they will give in that particular test, in the TOEFL test, and then they will assess you how your capability while taking the decision, and on that base, like the interview, they will select you. Okay, so this is all about the country where you want to go. So you need to check their website. Every information is available on the the website. As I told you earlier, it's all about on your fingertip. Just you need to think about in which country you're focusing, or in which country you're planning to go there and have your the career. So think accordingly and search for the information, so you will get the right opportunity with the right job, and with the right salary. That is very important.
Thank you, sir. The last question from Yasika is there, Yasika Sachdeva. How can a family professional should use his importance in the hospital setting?
Sorry, can you please repeat the question?
Yes, sir. How can a family professional has its importance in the hospital setting or the opportunities of family course?
Okay, PharmD course, as I told you, the basic thing, you should have the knowledge, communication skill, So you may get the job opportunity in many hospital setup. You can see the many, the Apollo hospital, or, Alpro hospital, or even you can see many, the healthcare setup are there. You will get the job there in that particular hospital setting. So you might be the hospital pharmacist, you might be the clinical pharmacist. It's depend which sector you are interested in, and again it's depend on the skill that you acquired in your might be in the B Farm or might be in the PharmD in your study time. So basically it's all about the skills and what particular skills they want from you. Okay, so every job you can see that the advertisement, they will be very clear about their the skills that the student should have. So if you have that skill, obviously you will get that opportunity in the hospital setup or maybe any other clinical setup itself. Okay, so as I mentioned in my earlier presentation, the hospital and community pharmacy, how they are differing from each other. Okay, the clinical pharmacy, they're having the role mainly at the patient centered, and the hospital pharmacy having the role in the procurement and the dispensing and all other things like distribution of the medicine in the hospital, so that how it differs. So it's depend on your interest, and then you need to follow if you are interested in government job, follow the government authority, government website accordingly. Also you can think about many websites, they are related with the pharma field, and they are posting a lot of job opportunities in all these sector, so think accordingly and go through all the websites. Okay, the info is available, everything online, so it's very easy. Okay, yeah.
Okay, thank you, sir, for your valuable response, and it will be definitely helpful. Now
Yeah.
I will hand over the session to the Ande sir. It is hand over up to you.
Yeah, thank you, Gulane sir. It's a very good session, that the question answering regarding with the clinical pharmacy. Right now, there is a less importance in India regarding with the clinical pharmacy and clinical research because most of the things are outsources from India. But real time in India, the clinical pharmacy practices are less. Due to this session, mostly the participant get motivated towards the clinical pharmacy. For this session, near about 556 participants have registered, out of which DPharm student attended near about 241, only 97, MPharm 155. Out of this, 30 are the faculty members, and 63 PhD candidates have participated in this international webinar. From that one, this is a session organized for the uh, clinical pharmacy and future opportunities from the training and placement cell of Dr. Rajendra Gode Institute of Pharmacy. Thanks, sir, for your valuable message regarding with the clinical pharmacy. Now it's a time for the valedictory function. I request Assistant Professor Anuja Mukule Madam to conduct the valedictory function.
Hello, am I audible?
Yeah, you're audible. Continue.
Okay. I'm Miss Anuja Santoshkumar Motture, Assistant Professor on behalf of Dr. Rajendra Gode Institute of Pharmacy. Feel honored and privileged to get the opportunity to propose a gratitude on this occasion of international webinar. First, I would like to express my gratitude to our Honorable President, Mr. Yogendraji Gode sir, for encouraging and inspiring us for this event. We are extremely thankful to Dr. I.L. Bakal sir, Principal of Dr. Rajendra Gode Institute of Pharmacy, and Professor H.S. Savarkar sir, Principal of Dr. Rajendra Gode College of Pharmacy, for unstinted support and minute-to-minute guidance to us. I take this opportunity to extend our most sincere thanks to Dr. Praveen Kumar Ingre sir, Senior Lecturer, Editor-in-Chief, Journal of Pharmaceutical Research and Clinical Practice, Walters Kluwer, Department of Pharmacy Practice, School of Pharmacy, International Medical University, Kuala Lumpur, Malaysia, from giving us his valuable time and an enlightening presentation on clinical pharmacy and future opportunity. We appreciate having this mysterious area clarified. Your words of wisdom will definitely help us. It was really eye-opening session. Sheds light on undisclosed area to us. Thank you, sir. I extend a very hearty gratitude to honorable delegates and all assembled faculties from different colleges who blessed us with their presence and took out valuable time from their busy schedule. I must mention our deep sense of appreciation to Professor P.V. Ajmere sir, Professor S.N. Ande sir, and Professor C.A. Gulhane sir, who organized and took all efforts to make this event successful. I would like to thank all participants and students for showing their interest in this webinar. I would like to dedicate a quote for all. If time is money, then today you have spent millions for us. At last, thanks to our webinar organizing committee and faculty members for their efforts and direct and indirect support. Further session hand over to Ande sir. Thank you.
Thank you, madam, for
Yeah.
thank you, madam, for your valedictory session conclusion. It's a very good time spent over here for this session, and sir conveyed very informative ideas regarding with the clinical pharmacy, future opportunities for the clinical pharmacist and pharmaceutical cares that should be amended as per the guidelines from the different countries. And in our upcoming era, this pandemic will give the much more opportunities to the pharmacists to get participate in the clinical trials, clinical research, and related to that area. So I request all the participants to get motivated from this session that delivered by Dr. Praveen Ingre sir, He is already engaged from last 20 years and more in a research sector and a clinical pharmacy profession regarding studies and its presentation. Thank you very much, sir, for presenting this session to us and giving your valuable words regarding clinical pharmacy. If there is any question regarding with this session, if may get asked from the participant will be conveyed to you regarding with the future communication. Thank you very much, sir.
Thank you, Ande sir, for organizing this with your lot of efforts. And again, special thanks to Bakal sir, Savarkar sir, and all the team members. Okay, so because of that only we are successful to have this international webinar today. Okay, and stay safe and stay healthy. Thank you so much. Yeah.
Yeah. Thank you, sir. Participants, you will get your feedback form in your WhatsApp group. So fill it and you will get the certificate as early as possible. If you are not getting that certificate within a time period, wait it up to the 72 hours. It will definitely get delivered to you. Thank you, sir.
Thank you so much. See
Yeah.
you. See you. Yeah.
Yes, see you, sir. Bye.
पहले कर लिए थे उन्होंने, सरकारी होते थे खरीदी करके लानी थी उसने, जैसे लॉकडाउन में तो इतना तो भी अच्छा हो गया, सब खरीदी करके ला ली थी बॉम्बे से उन्होंने।